Appreciate everyone being here today. You know, there's a lot of good things going on in the community. To me, one of the better pieces of advice that I got or suggestions that was made was my wife suggested to me that we go give blood this morning, and so we actually did that. We went out to Life South on Hillcrest Road, and in a period of about 45 minutes we were able to give blood, and they were tremendously grateful. And what they've said is that as of today, you know, our hospitals are in pretty good shape with blood, but knowing what's coming, or possibly predicting what's coming, they hope that you will call Life South or American Red Cross, and if you want to give blood, make an appointment and come in and give, and really, you know, it's painless. And it's something that you can do to help the lives of those who obviously are in the need of blood. And I think that you'll find that it's some self-gratification in knowing that you've done that. This morning also, I had a call from the governor's office, and they were weighing in about the possibility of standing up this convention center as an off-site hospital. Wanted to know what the thinking was in the community, so we called I called each of the CEOs of the hospitals and had 5 to 10 minute conversations with each one of them. To the person, all of them said they still had a lot of capacity at their hospital. You know, that they were not concerned at this point in time, based on the information they had, that they were going to max out and need an off-site hospital. As a matter of fact, I think to the person, they would prefer if there were going to be resources available to stand up an off-site hospital, they would rather those resources come to their hospitals so that they could convert maybe rooms that aren't being used for patients now, that they could convert beds into those rooms to handle what would be an expected surge. So I passed that information back up to the governor. There'll be later today a conversation with the Alabama Department of Health to discuss, you know, really what is maybe the next step and the necessity of an off-site hospital. I felt like that was very good information to hear that all of them had beds available, and all of them were ready for the surge should it come. I don't know about you, but in your mailbox at home, you may have received an envelope that looked like this, you know, a glass envelope, and it has Census 2020 on it. This is what the form looks like, okay? It takes less than 10 minutes to fill out that form. And for those who are sitting around and you're trying to determine something that you can do that's really productive, this is one of the most productive things you can do for your community and for the state of Alabama. So please, please don't let it sit on your desk any longer. Go ahead and fill that out so that we can make sure that we are all counted. The last couple of days we've talked about the situation with our homeless population. I think you now know that we have ordered portalettes and hand washing stations. I gave you 3 locations yesterday, but since the Salvation Army and Major Richmond are really coordinating this, they suggested that we change 2 of those locations. So as we stand today, the 3 locations will be the Dearborn YMCA. This is the Dearborn YMCA, which is downtown. Then you have the Salvation Army office, the main office or their location on Dolphin Street, and still have the 3 Circle Church at Imogene and Sage Avenue. We have tremendous gratitude for the Salvation Army for what they're doing, because and I think that what you'll see is that now you'll find some of the people that maybe are very interested in helping the homeless, that they will weigh in with the Salvation Army to make sure they successfully accomplish their mission. At this time, I would like to call on Dr. Bill Admire with the Mobile Infirmary Health Systems to give a update from his perspective. Dr. Admire.
Thank you, Mayor Stimpson. Good afternoon, everyone. I'm Dr. Bill Admire, the Chief Medical Officer at Mobile Infirmary, and I would like to just give you an update what's happening in the world of the hospitals and doctors and nurses in our county. First of all, I'm going to give you some quick statistics. Mobile, 300 cases thus far with 8 deaths. Alabama, greater than 2,500 cases with maybe 68 deaths, maybe 43 confirmed. This is always changing these numbers. United States, 450,000 plus cases with greater than 16,000 deaths, and worldwide 1.5 million cases and 92,000 deaths. Yes, it's a serious pandemic. Our community support here has been wonderful, and I attribute that to the communication by our leaders daily, whether it be press conferences on the radio and such to all of our people and citizens. Local businesses have been wonderful. Even in their time of need, they've been very supportive of hospital, donating food and even protective equipment to the hospital. Our priority right now at the hospitals, Infirmary, Spring Hill, USA, and Providence, is to have enough PPE, personal protective equipment, to take care of the patients and the healthcare workers. That's what we need. We're still ordering it. We're still going to need more in the next 4 weeks as this subsides, hopefully. And it's on order, but we have enough now. We've been planning and we're prepared. Ventilators. Everybody talks about ventilators. We have more than 100 at our hospital alone. There's 50 on order. We've received 13 the other day. The other hospitals have done the same, and they're getting more ventilators as they come in. If they're needed, we'll have them. We still doing testing. DMC, Diagnostic Medical Clinic of Infirmary, they're on Spring Hill Avenue, they're on Hillcrest, and they do pop-up tents, and they have drive-by testing. If you're symptomatic, you call 251-435-1106. Tell them your symptoms. You'll have a nurse talking to you. They'll give you an appointment. You drive by and you can be tested. That'll actually be for the virus testing, the RNA. We also do testing in the Infirmary Health System at 3 sites. It's also you call up and get an appointment. Different number, 251-341-2819. That's also, you tell them your symptoms and they can do a test with you if you drive by. One is at the Pro Health at the Infirmary, one is at the Thomas Medical Center in Daphne, and the other one's at North Baldwin at their fitness center next to the hospital. Also, to inform you that the local CMOs from the 4 hospitals here are collaborating in conjunction with the Medical Society of Mobile and Dr. Eichold from the Board of Health, just so that we're talking, all the hospitals, the Board of Health, and we're all talking to each other, and we're having planning that is very congruent so that we're giving the proper care. Very helpful. I want to reemphasize what we've been saying for the last month. Social distancing, hand washing, stay home order as per the governor, except for essential necessary travel, avoid touching your face, and avoid large crowds. Very common sense, but it is the difference. I think that we have blunted the curve in this area, and our projections have gone down on the number of cases that we'll have statewide and locally and the number of deaths. And this is a very good thing. If you compare it to our brothers and sisters up in New York City, they're having a rough time. In New Jersey, now in Detroit, Michigan, and other places. So we're very lucky. I think our leadership in this town, this city, has been excellent, and we're following the orders. Our peak, everyone's talking about modeling, when are we going to peak with the number of patients? We think that may be, and it can change, but we think it's going to be April 18th to the 20th or 21st. That could be our peak number of cases that arrive. And then that's the surge in the influx, and that's what our hospitals have all been planning for. Our priority is quality and safety of care given to our patients and protecting our healthcare workers. Mobile Infirmary, if you go to it now, it's very different. The 4th floor is just for COVID patients only, including the ICU. The ER has a tent outside of it. You get screened before you even walked in. We're going to separate COVID from non-COVID. DMC clinic has 2 tents, drive-by testing, and a pop-up clinic that doctors will come out and nurse practitioners and see you in the parking lot. We're changing the way we are. We have no visitors. We do have exceptions, case by case. That was asked last week. I want to emphasize this last thing. We as people are resilient. Humans have always been resilient since we've been on this earth. This is a pandemic, and we are handling it the right way. We're going to overcome it because we are resilient. We have a lot of courage, we have strength, and we're actually very responsible. So let's hope that in the next 2 weeks that we have a blunted curve, a decreased influx of patients or surge, and that we all work together. Final remark, our future is going to be different when we get through this, and we will. Our future is going to be one where the world, with 8 billion people in it, are going to have different personal hygiene habits, keeping your hands clean, keeping our social distancing different. We're going to avoid handshaking probably in the future. We may have a different custom. That'll be figured out over time. Also, we're going to be careful how we travel, because you know that's what happens when you travel. If it started in China at Wuhan and you had 450,000 travelers from China going around the world since that time, that's how an epidemic or endemic became a pandemic. But with these comments, I just want to say that thank you for having me here, and the Mayor Stimpson for everything he's doing, our Safety Director Jim Barber, and all of you, the media, for the good things that you do, and best of luck. Thank you.
All right, just update everybody on where we are with first responders for City of Mobile. We have just about completed testing. There's really been no real big updates because we're down to very few officers and firefighters that need to be tested. But we do have 2 that are outstanding PCR tests that we're waiting for, and only 4 confirmed cases of the PCR or the virus itself. So the City of Mobile has also ordered more of the antibody kits so that we can continue testing and make sure that we keep our first responders out of harm's way, and certainly not have asymptomatic first responders in close contact with the public. We did begin, as we promised, to issue citations last night for curfew violations. We had 19 curfew-related stops. We had 3 citations that were issued as a means to try to motivate people to follow the guidelines issued by the Mayor's Office and the City Council. We've also received numerous calls from people wanting to donate these homemade masks. And right now, as far as first responders, we have the proper PPE. As the doctor said, Dr. Admire, we are continuing to have to work on that supply chain. But where we see the greatest need, having talked to the health department, is in our nursing homes and assisted living facilities. And so what we've arranged for is for people to go through the Mobile County Emergency Management Agency in order to stockpile these types of resources so that we can get them to the populations that are the most vulnerable in our community, which are our nursing homes. And so the Mobile County Emergency Management is at 7350 Ziegler Boulevard, and George Talbot will send out this contact information. But the telephone line is 251-460-8000, and again, 251-460-8000. So anybody that has these types of masks that they would like to donate to make sure we protect those that are the most vulnerable in our community, they will stockpile it and make sure they get to where they need to be. There's been a lot of discussion about hazardous duty pay amongst first responders, and so we continue those discussions. And so one of the things that the chiefs, Fire Chief Mark Seeley and the Police Chief Lawrence Batiste, was go out to the field, talk to the guys, explain the financial responsibility and the financial crisis that we may be facing as a city. And I can tell you that both of them wrote back in written correspondence today, that overwhelmingly the guys in the field, the police officers, the firefighters, the paramedics, are in support of the fiscal responsibility of the city, the fiscal outcome of the city, and making sure that the city stays safe and that we don't have to get to a layoff situation. And so there's been no great demand from those guys in the field. They continue to do their jobs. They continue to do it every day, and they continue to do it very well. So thank you.
This morning in my drive about, looking at 2 of the testing centers, the numbers of people that were coming through those testing centers on day before yesterday, let's say were 100. Yesterday there were 50. And this morning it was just a handful of people that were driving through those test centers. You know, that's not a long enough time for a trend possibly, but it's certainly encouraging, and especially with all the encouraging words that Dr. Admire had about what the hospitals are doing. And although he represents the Mobile Infirmary, what he said about what they're doing there, you could just ditto at each hospital. So I hope that those who are watching this today will get a sense of comfort in knowing that we feel like that we are as prepared as we possibly can be as a community. It's really up to you the decisions that you're going to make about your social distancing, about your washing of hands, and those things that you know that you need to do in order to protect those that you may come in contact with. So I'll be glad to answer any questions that the media may have.
We received a letter from Anthony Maven, who is the president of the local Amalgamated Transit Union, the advocacy group for the Wave Transit employees here in Mobile. The letter basically says that they disagreed with your decision to close or to stop bus service, citing needs from the public, people who couldn't get around that needed bus service, essential employees. And they also said that Birmingham and Montgomery haven't stopped their bus service. So my question to you is, what is your response to that?
So we depend on First Transit, to make recommendations to us. They run buses all over the United States, is my understanding, and they came back and recommended, because of the way our routes are, that we pretty much have routes every hour. Some communities have the same route, a bus coming every 15 minutes, every 30 minutes. So in their opinion, it came down to a public health issue, and they made the recommendation that we shut them down. Based on all the information we are getting about the importance of social distancing, we felt it was the prudent thing to do because that was their recommendation. There are people all over the city that would like to be tested, not just our public service workers. There was a limited number of cases that was specifically given for those who have hands-on contact, and so the public service workers typically are isolated in a truck, especially our garbage guys, by themselves, so they don't have the exposure that some of the first responders or police and fire have. And so we are sensitive to the needs. We know that there are a lot of people other than public service workers that probably will test positive for the antibody. At the time when the testing kits become available for the general population and for others that probably have greater contact with the public, certainly we would consider that. But this time, because of limited resources, that is the reason that we have not done that.
That was memo was written on Tuesday. How many city employees have tested positive to your knowledge?
7. The question is, how many city employees have tested positive? So what we're saying is that 7 city employees have tested positive.
So that's 3 people besides the fire rescue.
That's 3 in addition to fire rescue.
That's of the swab tests, right? Positive swab.
That is with the swab test. Mm-hmm. Yes.
Address why that was. Can I talk about this?
Yeah.
Anybody too?
Yes, you may. Yep.
Let me try to, I guess, explain your question, the question about using the antibody kits on the first responders. And the mayor was saying that we go in direct physical contact with the public. And Dr. Admire can probably address this because I've been in close conversation with him, communication, about how to protect not just the first responders, but the public. And what we are seeing is that some of the first responders are asymptomatic, which means they show no symptoms of being sick, and yet they're in physical contact with the public on a daily basis. So it's very important that we identify anybody that's carrying that virus, an active virus, into the community and get them quarantined so that we're not spreading the virus, which is completely opposite of what we were trying to accomplish. And the mayor's right, we had a very limited amount of antibody kits. We chose to make sure that all our fire rescue as well as police that are in close contact so that we could identify those people that are asymptomatic and get them quarantined. And so they are unable to social distance like everybody else is doing here. And so that was one of the main reasons to go for them first. And again, Dr. Admire will be glad to discuss why those antibodies testing is so important, especially in asymptomatic patients.
Another question?
We've had a lot of people contact much got stuck in a similar situation. They didn't have long to prepare for this. Unemployment offices didn't have long to prepare for all of this hitting. But people who I've spoken to have said the schools have done a great job calling them with robocalls, at least updating them to the situation. Is there any likelihood that people trying to file for unemployment might get some kind of robocall helping them know what's going on, or is there any?
Yeah, so the question is that there's been a lot of frustration from those trying to collect unemployment, and it's simply what you said. The system is overwhelmed. Just to put it in perspective, I think if you take the last 3 weeks, there have been 17 million people across the nation filing for unemployment. You know, I don't know at a high point, but it was like 500,000 was used to be a big number. I don't really know what the state and federal government, what governments are doing to assist that, whether it is the robocalls to try to expedite it. But I know that they recognize that they need to do better than what they're doing, but it's a matter of getting personnel trained and get the equipment to do it. So I don't have a good read on that.
For families who are going through this, I just spoke with a family today who says the dad got laid off 3 weeks ago, or he was furloughed 3 weeks ago. The mom, similar situation, and now they're starting to worry about running out of food. They have children at home. What would you suggest for them? Should they maybe try to look at some of these food distributions, or?
Well, the question is that after 3 weeks of unemployment, or the comment is really, after 3 weeks of unemployment, there are people who are genuinely running out of money and running out of food, and so where do they turn since the unemployment compensation has been slow to come? And your suggestion that, go to the food pantries, or to the Salvation Army, those are the places that you would hope that they could find help. The point you make, though, is I think it's reflective of a lot of systems being overwhelmed in this coronavirus right now. And everybody is scrambling. Of course, the primary target initially was the PPE. Okay, and so we finally heard Dr. Admire say it looks like that we've got the PPE that we need. It's going to come. I just don't have a way to predict how long it will be before some people start getting checks. I just don't know.
We're still a few days off from possible severe weather hitting our area on Sunday, and there's been some talk about what to do. I mean, obviously the social distancing, but if a tornado's coming through life there. Do you have any recommendations, anything the city is recommending in this situation? Because April is a secondary severe weather season for us here in Alabama.
So severe weather threats, in this situation, when there's the stay-at-home order, is Easter weekend, there'll be probably people out in cars, at church services, in the parking lots and so forth. Tyler, I think that the best information is to do just what the National Weather Service is predicting. People are definitely tuned into the TVs right now. They can tell you pretty close proximity where you need to take cover if there's dangerous weather coming.
Should they follow at that point the social distancing kind of goes out the window if they need to get to the same area?
Your comment is that the social distancing go out the window if a tornado's coming. I think you answered your own question. Yeah, I think that you're going to protect yourself. At least I hope you do. I don't know the answer to that. The question is, will tornado shelters be open? And I don't know if, I don't know. Yeah. Say it one more time? Okay, so the question is that I'm going to just say generically, there are hospital employees, probably at all the hospitals. I'm assuming that because we know it's true at some. What are they doing? They're treating those patients like they would any other patients. They're either quarantining and sending them home, or they are treating them as if they are a patient. And we all recognize probably some of the most vulnerable, or certainly the most exposed, are our healthcare workers. So they have a heightened sense of trying to take care of their personnel. So I'm fully confident that they will handle that in the right way. But there may be this belief that everybody gets the coronavirus has to be hospitalized. That is not the truth. I mean, there are a lot of people, all they do is go home and they have symptoms of the flu, but they are positive for the coronavirus, but they do not have to be hospitalized. Yes. For who? Yep. Okay.
Speak loud. Yes, sir. Yes, sir. The question was, on our 4th floor at the Mobile Infirmary, how many beds do we have? We have 14 MICU beds, medical intensive care, and they're all ventilator capable. We have another wing that we converted, 25 more beds that are ventilator capable, so that's a total of 39. Then we have another 40 beds for general medical surgical beds, and we're adding more this weekend. Our chief nursing officer is adding another 20 to 30 beds on another wing. So we're going to be, if you add it all up, we're going to have close to 140 beds on one floor. That's phase 1. If it gets a surge, we're going to go to phase 2. We'll add another intensive care unit. It could be a 24-bed surgical intensive care unit. It could be our PACU. And we have another floor on the 3rd floor that we could convert a whole wing to more beds. So I think at the peak, we could be close to 250 beds or more that we could make into a COVID unit, along with the other hospitals doing the same with their capability.
I have a question as well. If we do see the peak between April 18th and April 21st, where would that put us at kind of this slowing down and things starting to come back to normal?
The question was, if we do have a surge and a peak, and we peak from the 18th to the 21st of April, when can things return to normal? When will you have, that's the acceleration phase, you hit your peak, and then you have a deceleration phase. I would predict 4 weeks, the numbers start continually going downward, and then based on statistics and testing, we'll have more testing available, then we can say, when can we get back to normal? And we're going to probably do that in phases also. But that'll be decided between leadership in the community, health officials, physicians giving their expertise, advice on healthcare, because what we don't want to do is have a deceleration, everybody lets their guard down, then we go right back up again. But I'm sure that we can get back to normal this summer. That's an optimistic attitude. I'm not guaranteeing it, but I would gamble yes.
Those models that you were talking about, how they've changed with the number of beds, how accurate are these projections? I mean, obviously they are statistical numbers, so it's a moving target. I mean, are you guys really relying on these as a way of preparing? I mean, how accurate do you think they are?
The question was, how accurate are the models that the experts nationally are giving for us to look at? What they do is they look at your population census. We have a density, what our population density is. It's not the same as New York City. We have 300, 400,000 in this local area, and we're a bit more spread out than New York City is. They're on top of each other, which means they're not social distancing. So the models are accurate in the fact that it's constantly moving, and they always have a mild, moderate, and severe prediction model. And there's a number of factors you put into it. So I'm always looking at the moderate to see where that is, and then gauge it based on what our actual numbers are showing. So right now, it's interesting that the national statistics for the state of Alabama have shown our expected peak to be lower than originally thought. Now, we can't let our guard down, and then it could go to moderate or even mild, which would be excellent.
As the CMO of Infirmary Health, do you attribute that to the fact that social distancing, the stay-at-home order, the curfew are all working in our area?
I would say we have done a very good job with our social distancing, the mandates that were put out by the governor and our mayor and everyone else giving us cues on what we're supposed to do regarding social distancing, stay at home, what we did with our restaurants, what we did with our social gatherings. These things are all important and contributed, and I think we used a lot of due diligence and we used a lot of analysis to make those decisions, and they were good.
We've heard from nurses at a number of hospitals, and given the fact that they have ceased doing most elective surgical procedures, we've heard from some nurses that they've been furloughed or laid off. It seems counterintuitive that would be happening right now. Can you speak to that?
Yeah, the question was about at hospitals about elective surgeries have been stopped. What we're doing is we're only allowing urgent and emergent surgeries. Elective surgeries will be postponed to a later date. And then you have the question is, if you're not having the surgeries that you normally do with your workforce, what are they doing? We have not laid anyone off at the Mobile Infirmary. We're putting them in other areas of the hospital. We're cross-training them. We're going to use those in the COVID units and other parts of the hospital. We'll do our best. We evaluate it week to week, how we can do that to make sure our workforce is employed, and we need their help.
There's a question. For people who've tested positive but have recovered and supposedly been cleared to go back to work out in the world, can they still carry and transmit the virus if they have another exposure?
The question is, if you test positive and you're sent home from work and you're put into quarantine for a period of time, that way you won't expose other healthcare workers and other patients in the hospital that don't have COVID. It's a period of time that you have to be asymptomatic, 10 days, 14 days, and then you come back and you take a test and you turn negative and you have no symptoms for 10 days, we can put you back to work as long as you wear personal protective equipment to avoid transmitting it, because there's been speculation that you can still shed the virus and still contaminate or spread it to other people.
And they catch it again, you know?
Yes, we test. If you test positive and we send you home, you'll quarantine, self-isolate, practice all the social distancing, and when you feel better and you come through the disease, you'll get tested again, and you have no symptoms for a period of time, as I mentioned, 10 to 14 days, you can get back to work.
Catch it again.
Yes.
At this point,
There's a testing protocol and there's a non-testing protocol. If it's non-testing, it's a longer period of time, no symptoms. If you're tested, it can be 7 to 10 days, no symptoms, we can put you back to work.
can you catch the virus again?
Yes, we'll test for the PCR.
No, he's saying,
Like, can you catch it again? Or like,
Oh, I'm sorry. Oh, yes, sir. All right, I'm with you now. Thank you. You're saying if you have the coronavirus and you get over it and you're cleared, can you catch it again? There's been speculation on that, but there's no written evidence in the literature right now that it occurs. But they speculate it might happen, but that is not proven from what I've read.
Would it be like a few weeks from now you can catch it again? Or like because obviously it's probably better if like a nurse had caught it and then they're back to work after being cleared.
Right.
Obviously,
You would suspect that if you have the disease and you're quarantined, what has your body done? It's built up immunoglobulins, immunity to it. So you have that IgM and IgG that's going to protect you from the disease again. That's how the body works. And they would be the people that we would use to be plasma donors. After they have a certain period of time, then they can give their plasma and donate to people that have disease severely.
are you guys doing anything with that?
Yes, we're doing that at the infirmary. Dr. Eunice is leading that. We have a plasma, it's called convalescent plasma exchange. And we're going to start now that we know who's positive, so we're working on an itinerary of those folks. And then in the future, we could probably use them to give a plasma donor.
Should people reach out to you if they were confirmed positive with it to see if they've been donating plasma to you guys? Are you guys not at that phase yet?
We're not that phase. It's too early right now. Okay, they've done that in China, Spain, and Italy. We'll soon be doing that in the United States. As a matter of fact, they did 2 cases just recently, one in Denver and one in Houston, Texas. Thank you.
Okay, time for about 1 or 2 more questions. Well, let me close with another good Samaritan story. Last night, sending out the newsletter, we asked people to share stories with us, and we had several responses, but one of my citizens, Mary Catherine Zarza Williams, was paying attention on social media what some of her friends were doing, and what they were doing in another city. This friend was raising money, then buying meals from local restaurants and sending to hospital staffs. And after thinking about it and a little encouragement from her husband, she decided, I'm going to do that. Thinking if I could just do 100 meals, it would be a pretty neat thing. But she's been overwhelmed by the response we've gotten. The number of restaurants that have stepped up said they would like to participate, the number of donations. There's a GoFundMe account now having to deal with this. And so that story, along with hundreds of others, along with what Dr. Admire is sharing with the things that the hospital and our healthcare workers are doing, the things hopefully that our government is doing to get money to people on a quicker basis, I mean, we're going to push through this thing, and I think we're going to push through it a whole lot quicker than people think we could have done. Because already, I don't think people thought that they thought it would be a lot worse than it is right now. And thank God it's not. So anyway, look forward to talking to you tomorrow and possibly over the weekend in some form or fashion, but it won't be in the atrium here. Thank you very much.